Hi, my name's Emma. I'm one of the senior play specialists here at Leeds Children's and I work on the Children's Heart Ward. And today I'm just going to quickly talk through you coming in for an operation. So this is my special teddy bear and he is called Reese. And he has a storybook all about him called Reese Bear Has an Anaesthetic. So I'm going to talk to you about Reese and him coming in for an anaesthetic. Okay, so Reese is going to come in for a special operation. He's been and seen the doctor and the doctor's looked at him and the doctor says that he would like to try and have a look at his heart in a bit more detail and maybe try and help it to work a bit better. So to do that, he's going to send him to the doctor to have some tests to make sure he's all fit and well for him to do those tests. So to do that, he's going to come in and the first thing he needs to do is he's going to see one of the nurses and they might want to put some special cream. This is very, very clever cream, this, and I've got some already on the back of my hand, and this clever cream on the back of your hand is going to help it so that when the doctors want to take a little bit of your blood, you shouldn't be able to feel it as much because you've had the special clever cream on. So they'll put that cream on and then you'll go off and you'll do a few other little things, little jobs, and one of those will be an x-ray. So an x-ray, all you have to do is you have to sit still and you have to sit up like this and a big machine comes down and takes a picture of your heart, and your heart is inside your chest just here where I'm holding on Reese. So they'll take a lovely picture of your chest and they might want to take you and have a picture at the side as well, in which case you might have to put your arms up if you want to have a side picture as well. Don't forget to smile for the pictures, and once they've done the pictures they then might want to have a look at how your heartbeat looks, and to do that they might use some stickers. Now they could look a little bit different to the ones I've got here, but these stickers will go on your chest and they might go on your arms and your legs as well, and then they'll attach to this little clip here, they'll attach another little clip, and then they'll have a look and they'll get a picture and it'll print out on a nice piece of pink paper some wiggly lines that shows how your heart is beating. And once they've got that, you can take that back, and then the nurse will want to do some little jobs as well. So the nurse might want to do a little job at testing different parts of your body, and so we have a little stick like this. It looks like a little cotton bud at the end, and with this one they might want to pop it into your mouth and then your nose, okay, and then they might get another couple of sticks, and for this one they'll go under your arm and they might go at the top of your leg, and all these get sent off for the doctors to look and check that everything's okay and that you are as fit and as well as you can be for coming into hospital. So that's one of the jobs the nurses will do. And then they'll want to find out how much you weigh, so they'll ask you to sit on some scales, and they'll want to find out how tall you are too. And that will help the doctors to know how much medicine that they need to give you for your special sleep when you come in for your operation. And when it comes time for your blood test, they'll take off this cream and we can use some special clever water we've got, this one here, and we can drip it on, and it helps the sticky just slide off really easily by dipping on some of this, and then they'll take a little sample of your blood, and sometimes if they need to they might leave one of these in. This is called a cannula. This is a little bendy tube. I've got one here to show you. It's a little bendy tube, can you see? So that's just take a little bit of the blood from you. And then when they've finished, they'll put a little cotton bud over the top of it to stop it from bleeding, and then afterwards you get a fancy little plaster to pop on the top of your hand. Okay, so these are some of the tests that will happen when you come in for before your procedures. These are all things that the doctors need to know how well you are before you come in. When you come in for your operation, we'll talk through this leaflet and you might be able to see me or Gemma on the ward, and we'll have a chat with you about stuff, and we'll talk you through the book, and we'll have a look at the Katie Bear Goes to Hospital book, because you'll get given one of these as well when you come to clinic. And then we can talk about how you can have your special sleep. And the two ways you can have your special sleep, one of them is using the little bendy straw and some medicine that can go in just into there, or you could have a little mask just to do some big breathing. So this goes over your nose and your mouth just here like this, and you do some big breaths just like Teddy's doing there. Okay, and when you're fast asleep, so that you won't be able to see, hear or feel anything when the doctors are doing the operation. And then when you wake up, your mummy and daddy can be there with you.